Hi guys, welcome back. In this video we shall be talking about lung cancer. It is a very important topic that we should be aware of lung cancer, the symptoms, the causes, the basic treatment and how you can prevent the lung cancer in the first place. Let me tell you guys, the most common type of cancer, the most common cancer in the entire world is actually the lung cancer. Yes, the most common type of cancer in males in the entire world is actually the prostate cancer. The most common type of cancer in females in the entire world is actually the breast cancer. But if you combine males and females, the most common type of cancer in the entire world is actually the lung cancer. So you can understand the burden, you can understand the prevalence, you can understand the amount of cancer that is in the entire world and how much amount of that is actually the lung cancer. It is the biggest chunk is the lung cancer. So we should be understanding what are the symptoms and how you can prevent it in the first place. So what are the risk factor of you having a lung cancer? That means what are the things that you might be doing or something that is occurring to you that can put you in the risk of developing lung cancer. If you know this risk factor, then you can prevent the lung cancer in the very first place, right? So one of the very important cause of developing lung cancer is actually the smoking. The tobacco smoke that you do is very dangerous. You cannot list out the harmful effects that the tobacco smoking does to your body, right? Along with this, it puts you in a very significant risk of developing lung cancer. The number one cause of lung cancer is actually the tobacco smoke, right? Also, you have to understand there is something known as second hand smoke. That means even if you're not smoking, if your friend is smoking and you're sitting in the same room, you can still have the lung cancer. That is something known as second hand smoke and still get the effects of the smoking, even though you're not smoking, but you're staying very near to your friend who is smoking. So please try to understand, whenever some of your friends are smoking, please walk out of your room. That's why smoking is banned in public places, right? The second thing is that if you're working in certain kind of industries or refineries that are getting you involved in the heavy metals. Now what are these kind of heavy metals that can put you in the risk of developing lung cancer? You're working in some sort of petroleum industries, or you're working in some kind of your paint industry. So if you're getting exposure to arsenic, if you're getting exposure to arsenic, or you're getting exposure to nickel or your chromium, yes, if you're getting exposure to chromium, arsenic and nickel, you are putting in high risk of developing lung cancer, right? Also, if you're getting exposed to radiation, now if I tell you this scenario for this, if you're having COVID-19 infection, even if you're having mild form of COVID-19 infection, even if you're having mild infection, people are doing a lot of CT scans. Yes, CT scans is very much radioactive. That means it can put you in high risk of radiation. CT scan itself can cause you lung cancer. So please do not do CT scan unnecessary unless it is very well indicated. That means you need to do the CT scan. CT scan is very effective imaging technique, but it is coming with a huge amount of radiation. That's why you are never going to do CT scan in the pregnant lady, right? So it is so dangerous to the pregnancy. So if you're doing CT scan for no reason, even if you're having certain kind of very mild kind of infection, any lung pathology, just for diagnostic you're doing CT scan, it is not very good. So you have to understand the risk and the benefits, right? If the benefits is more, obviously you'll be doing the CT scan. If you get a chest injury, you get a head injury, you'll be doing a CT scan, because the risk is the benefits are more. But just for COVID-19 infection, just mild kind of infection, you still want to do CT scan, it is not justified, right? So please let your doctor decide whether you need a CT scan or not, right? The another thing that you have to work around, if you're having any kind of pre-existing lung condition, like if you're having tuberculosis, or if you're having certain kind of fibrosis, or if you're having certain kind of COPD, yes, this can put you in risk of developing lung cancer. So these are the risk factors that you should watch out. If you are having this risk factor, then you should be more aware that you might be developing lung cancer in the first place. So now, what is the symptoms of lung cancer? You have to understand what is the symptom of lung cancer. So what are the symptoms is that you will be having cough. Remember, cough is the very important symptom of this lung cancer. You will be having cough for a prolonged cough, like 2 weeks or more than 2 weeks, 3 weeks, you'll be having this cough. Along with this cough, you will be having, most likely be having a dry cough. But if you're having infection, you'll be having a productive cough. That means you'll be producing the sputum, but generally it is dry. And whenever you cough, you will be having blood in the sputum, right? You'll be having blood in the cough, and your cough, the history of the cough will change. That means your sound might be changed, your voice might be changed, your intensity of the cough might change. You might be coughing more, the frequency might increase, right? Because people who are smoking, people who are having a long history of smoking, they generally cough. They know they are coughing because of the history of cigarette. But if they see they change in the pattern of the smoking, change in the pattern of the cough, you should be very much cautious, right? And get it checked with the doctor. Second thing is that you'll be having blood, as I told you. The third thing, you'll be having chest pain or shoulder pain, right? With this, you might be having weight loss, you might be having fever, you might be having shoulder pain, chest pain. You will be feeling tired, you will be having change in the voice. With this, you will be not feeling like to eat, you will be having anorexia, right? So these are the symptoms that you might be developing cancer. Please try to understand, if you're having cough and you're having blood in the sputum, it's a high chance that you might be having tuberculosis, and it's also a high chance that you might be having a lung cancer. So you cannot diagnose with the basis of history. That is the reason we have investigation. So even if you're having this kind of symptoms, please do not wait and do not spend time at your home. You should immediately rush down to the hospital and get it checked by a professional doctor, because the earlier you start the treatment, the earlier the treatment is started, the better outcome it is. Yes, we do have treatments for lung cancer, but it is not as simple as it. If the condition is more severe, if the staging is more severe, then yes, the outcome is not very good. So what do you expect then whenever you go to the hospital? What is your doctor actually going to do to you? First thing first, he's going to tell you to do a chest x-ray. In the chest x-ray, he might be seeing a white opacity. That means he might be seeing a white kind of shadow. And if you give a closer attention to the shadow, if you see the surrounding, if you see the boundary, it will be like irregular boundaries, right? Along with once he says, okay, this is the thing, then he might be ordering something known as biopsy. Now, how is he going to take the biopsy? That means he's going to take out a small chunk of the tumor and place it under the slide and give it to the pathology department, and those guys are expert in detecting cancers. So they'll see under this slide and tell, yes, this is a cancer cell or it is a normal cell, right? So how is he going to take the biopsy in the first place? He might be using a syringe and using a ultrasonography and directly saying with the help of ultrasonography, and he'll be inserting the needle and just take out a tissue of that. It's one condition. Second condition, second technique he might be doing with the help of a endoscope. He'll be putting an endoscope. What is an endoscope? It's a tube-like structure which is fitted with a camera and a light source. Will introduce and directly see under the camera and then take a tissue of that. Or sometimes you might be giving a small incision around your neck area. He'll take out the tissue. So once the tissue is taken out, we'll place it under the microscope, see it, is it a cancer or it's not a cancer. Now if it's a cancer, now the whole game changes. If it's a cancer, then he will stage the cancer. What kind of, how severe is the cancer, right? That means, is it the cancer located in just one lung or the both lungs? If the cancer size is less than 1 centimeter, or the cancer size is around 3 to 7 centimeters, or the tumor size is more than 7 centimeters, or if both the lungs are involved, or if this cancer is actually involving your lymph nodes, right? So these are the staging done by the pathologist in order to tell what is the type of cancer, how severe the cancer is it, right? The more higher staging is it is the outcome is more bad. That is the reason that you should be able to catch the cancer in the first place in an earlier stage. So please give more attention to the clinical symptoms. That means the symptoms that you might be having lung cancer, and also give good attention to the risk factor, because as I told you, in developing countries tuberculosis is very common, right? And you're smoking and you're having the symptoms, please go rush to the hospital. Yes, high chance that you might be having a tuberculosis, right? But you might be also be having cancer. As I told you, the most common type of cancer in the entire world is your lung cancer. So it's a very high chance that I might be having a cancer. You might be having a cancer. Third person might be having a cancer. Since it is most common, it is more likely to occur, right? That is the reason it is most common. So once the diagnosis is made, they have staged, then they might be doing some treatment. So the treatment is the very common treatment they will do is surgery. They'll do a surgery, they'll take out the tumor and throw it out, right? Depending on the area of surgery, area of tumor, size of tumor. So it is a very good treatment to take out the tumor in the first place. But sometimes what happens, if it is a very big kind of tumor, if it is involving both the lungs, right, and if it is involving the lymph nodes, then the surgery is not very effective. Then they will switch to chemotherapy or radiation therapy, because if both the lungs are involved, what will you throw out? Will you throw out the entire both lungs, and how will you survive? Now you can do a lung transplant, but it is not that easy to do a lung transplant. You need very high sophisticated expert team, you need very high sophisticated medical hospital, you need a very effective lung donor. Then again, you are having some risk of organ transplant, so organ rejection. So it is not very easy to say, okay, I'll do a lung transplant. No, it is very difficult, because lot of conditions, a lot of factors are involved. So it's not very easy to say I'll do a kidney transplant, just I'll do a lung transplant, because there's a lot of things involved. You need a lot of cash, you need legal issues, you have expert team, you need to get an appropriate donor. Then you have to for the entire lifelong, you have to be very cautious that your immune system will be reduced, because you'll be given corticosteroids to reduce your immune suppression. Again, if you're doing this so that your body does not reject the organ, if you are doing this, then again you are having chance of developing opportunistic infection. So please do not think about the organ transplant so easily, that you'll do the organ transplant and I'll be fine, fit and fine as like before. No, you cannot do that. So the entire aim of this video is to please, you should understand the symptoms and catch the symptoms in the first place. And once you find the symptoms, please do not waste and do not ignore it, and just immediately rush to the hospital. That is the reason it is very important that you should do a regular periodic medical checkup at least once a year. At least once a year you should go and do your medical checkup, even if you are not having any symptoms, any problems, because your body will try to compensate. Your body will not show symptoms unless it's a very massive problem, right? So that's the reason, please get it checked and do your periodic medical checkup in a yearly basis, right? So again, symptoms are what I like to revise, that is the chest pain. You'll be having chest pain or pain in the shoulders, or you'll be having shortness of breath, difficulty in breathing, chest tightness, you'll be vomiting out blood, you might be having a sputum that might be having blood, you might be having sputum, you'll be having chronic cough, you might be having a history of smoking or radiation exposure, right? Long radiation exposure. So these are the things that you should watch out, and please get it checked as fast as possible to prevent or to halt the progression of the disease, or to catch hold of the disease in the first place in the earlier stages, and then the treatment will be better for you. That's all for now. I hope you take care of yourself, and I'll see you in the next video. Thank you.